We know that lung cancer can be associated with smoking. Nancy's already testified to the fact that she was a smoker, and often patients who smoke live with other smokers, and those that don't smoke are exposed to passive smoking. And of course, there's the whole biology, the genetics of these tumours. In somebody like Nancy's situation, is her son at increased risk of developing lung cancer? And if so, is that because of the potential risk of passive smoking, living in the same house? Or is it the biology of the fact that if mum's had a tumour, he's more at risk of having lung cancer himself?
So that's a good question. There is some familial risk. I think my biggest pet peeve as a lung oncologist is this association with smoking and lung cancer, because most people who are diagnosed today are either never smokers or people who quit smoking decades ago. We don't know all of the risk factors for lung cancer, and a common question, especially in our never smokers, is, do I have to worry about my children? There's one genetic abnormality, something called the germline T790M mutation, which we see in a small cohort of patients that we do know can put patients at risk for lung cancer, similar to how BRCA puts patients, family members at risk for breast or colon or prostate cancer.
Right.
But for someone who is diagnosed with lung cancer later on in life and who has children, we don't really know what the true risk is, or is this just a disease that we know can happen in, not that I'm calling you old, but can happen in older patients?
I'm just going to end, Nancy, by asking you, do your friends at the golf club and friends in the community, do they know about your diagnosis? Do you talk about it with friends?
Yes, and if I don't show up one week, they march right up to me and want to know, where were you? Were you sick? Were you in the hospital? Yes, they check up on me.
And typically, we often think that patients with lung cancer look seriously ill and feel very unwell, and yet you're the exact opposite. Are people shocked to hear the diagnosis?
Yes, they really are, yes. And I'll tell you one thing that I do that maybe shows up in my age. But the other day I was going to the post office and there was a young girl, beautiful young girl, standing there with a cigarette. And I walked up to her and I said, it's none of my business, but, and I told her what happened to me. And I said, you're far too pretty to go through this. And she looked at me and she said, I've needed something to make me stop. I think you're it.
Wow.
So you never know. You open your mouth, put your foot in it, but you try.
Well, good on you for being such a strong advocate, particularly...
But she was so pretty, and I hated to see it, you know. I don't want her to go through this.
Well,
it doesn't bother me that much, but it's not something that you would wish on anyone.
Sure. But obviously, many people who are in their teens and 20s, they think that it's never going to happen to me. Mm-hmm. Well, I thank you so much for sharing your story. You are truly an inspiration, not just to us in the medical profession, but also to patients and caregivers watching this. And I wish you well. I hope that the diagnosis has not affected your golf handicap, and you have done absolutely fantastically.
The fact that I go out affects it.
I wish you well.
Thank you very much.
Thank you to Dr. Horn and Dr. Martin for weighing in on this session. Thank you so much.
Thank you.